alone in lockdown London. Fleeing Hong Kongers seek new life. Pregnant women at higher risk for COVID-19 infection. Study says Chinese lab probed in COVID-19 outbreak to receive U.S. funds until 2024. Report alone. How Italian town with first known virus death feared the Centers for Disease Control and Prevention's overly burdensome guidelines on returning to school are dismissive of science, which shows more kids die when schools are closed, according to a Johns Hopkins University Dr. Marty Makary penned a blistering op-ed for Fox News claiming the agency's new guidance calling for a phased reopening of K-12 schools, which is based on community transmission. Defying science, the guidelines create testing and distancing requirements so extreme it makes consistent in-person learning unachievable for the vast majority of schools in America today. Makary, for instance, if a community has a high rate of COVID transmission, the CDC says students and teachers will need to be tested. That's not easy to set up for many school systems. He said the guidelines were dismissive of data showing the negative consequences that school closures have had on youth, including higher rates of suicide and substance abuse and an increasing hunger crisis as kids go without meals normally provided at school. These problems may not be evident to wealthy autocrats working remotely in mansions, but in places like inner-city Baltimore, closed schools can have brutal health consequences. He added, if we are really listening to the science, it tells us that more kids die when schools are closed than when Makary, a professor of surgery and health policy at Johns Hopkins, also underscored the hypocrisy problem facing the CDC, that Director Rochelle Walensky heralded data showing low transmission rates within schools just before the agency made reopening contingent on community transmission rate. Many believe what is really happening is that the Biden administration is outwardly calling for schools to be open but behind the scenes accommodating teachers' unions by subtly stalling on implementing a reopening. Makary, he did, however, note a few points the CDC did get right, including instructing kids to wash their hands and wear masks in school and having well-ventilated space. I strongly encourage school board members, parents and local government leaders to find a path to reopening quickly with universal masking, 3-foot distancing and good ventilation. Those precautions have kept pilots, flight attendants and airline passengers safe a million times over despite a smaller space, a higher density of people congregating together, no testing requirements, and a higher risk population. The White House plans to reopen 50% of the nation's schools for as little as 1 day a week, despite President Biden vowing to getting a majority of K-8 schools safely open within his first 100 days in